Good morning, good afternoon to all of you. It is a pleasure for me to be here today to briefly introduce the eWaste Challenge MOOC, a massive open online course that is published and available online to anyone through the web, and also linked to the lecture of today, which will follow my brief presentation. I'm a program officer in the Basel, Rotterdam and Stockholm Convention Secretariat, as mentioned by Dan, and I will be very brief presenting the background of this massive open online course. The course is a result of a partnership between the Climate Kick, the EIT Climate Kick, the European Union Institute of Innovation and Technology, the Basel, Rotterdam and Stockholm Convention Secretariat, the World Resources Forum, and KU Leuven. And it is directed to a wide audience. For example, waste recycling managers, urban planners, graduate students, recycling operators. It focuses on the ESM of e-waste, the challenges and opportunities linked with e-waste management. The MOOC involves 30 or 40 hours of learning provided in short lessons that we call nuggets. There is a discussion forum linked to each nugget, and the MOOC is available since the 4th of April for 8 weeks. There are webinars and interactive sessions like the one of today, but afterwards it will remain available as e-learning, and the learners will be able to take it at their own pace. The MOOC is hosted by the platform of the Climate Kick, which is called the Innovation Primer, and as mentioned, this platform allows the participants to continue to read the MOOC and access it at all times. The nuggets, the short lessons, are organized in 5 modules. The lecture of today is included in Module 2, e-waste impacts, environment and health, and in what's inside e-waste, still in the Module 2. The MOOC, in order to receive a certificate, requires the completion of the challenge. The challenge or canvas is a project that could be an improvement, an innovation, a campaign, a community initiative, a research project, or a business idea. It should have the potential to have a positive impact on environment and health and helping to prevent human-made climate change. And it has to be submitted to receive the certificate. The entire MOOC and the different modules can be used as background information and materials to complete the challenge. The MOOC, as mentioned, offers forums and groups organized by nuggets, and it is possible to post the scrapbook, the notes and questions, and there is a moderator for 8 weeks who can answer the questions and help the participants to complete the MOOC. So join us for this challenge, help to advocate solutions and be part of the solutions, and connect to the link you see here to take the MOOC with us. The MOOC is being developed in partnership with, as you see, the Climate Kick, the Basel, Rotterdam and Stockholm Conventions, the World Resources Forum, and KU Leuven. But a new partner just joined this adventure is the Raw Materials Kick, who will be bringing this MOOC to its network of universities. So thank you for your attention. I'm very happy to pass the floor to Dan.
Yes. Can you hear me now?
Yes.
Yes. Good. Thank you so much. And thank you, Francesca, and thank you for the organizers for inviting WHO to provide a perspective on health, on child health, to provide the more human impact and health impact aspect to this story. Actually, we started working on e-waste in the World Health Organization about 4 or 5 years ago, and it was the Basel Convention actually that approached us in the first place at the same time as our collaborating center in Thailand and our collaborating center in Utrecht, who were working together on a pilot study looking at the metals that they were finding in schools that were surrounding electronic waste informal recycling sites. And this has led into an initiative that we have been carrying in WHO for a few years, working with many partners. So today I wanted to start by giving you a brief overview over why we care about children's health, because usually when we think about e-waste, we think a lot about the workers, but not necessarily about the children. And so since the audience is so varied, I thought we would start with a small introduction to why we care about child health and these environmental, very strong environmental risk factors.
Word.
So anyway, we care about children's health in relation to e-waste because children have different exposures than adults. They have a dynamic physiology that doesn't allow them in many times to get rid of the toxic materials in electronic waste, that doesn't allow them to metabolize some of these toxics in e-waste because they are going through development phases that make the different components in e-waste have a stronger impact on the future health because they have a longer life expectancy and because, of course, they are politically powerless. So a child is exposed to the components in electronic waste already through the placenta. Many of these components, lead, mercury, they easily cross the placental barrier. And even if in the past we thought the placenta was a wall protecting the fetus, it is not. We also see that many of these contaminants accumulate in breast milk. And so they are being passed on to the child through breastfeeding. At the same time, as you know, the children explore, put things in the mouth, put dust in the mouth. So when they are either working, when they're living, when the parents are working in an e-waste recycling area, or when they are exposed to the e-waste components themselves, it ends up being somehow in their mouths and in their systems more easily. And of course, they're closer to the ground, and they do not understand the idea of danger. So through the occupational risks of the parents, they can already be exposed while they are in utero, but also, as we saw, when they are small, and during childhood, sometimes they work, which they shouldn't, but many times they help their parents work, or many times the work happens in the houses. Then, as we know, in adolescence, adolescents already start working, so that's another time when e-waste exposure occurs. As I mentioned, breast milk, I wanted to highlight once again that breast milk is the best food for an infant, and we are quite concerned about the contaminants that could go through in breast milk, but we still promote exclusive breastfeeding for the first 6 months of life, because in many cases, and especially as a lot of informal e-waste recycling happens in socially adverse conditions and in very poor environments, sometimes it's the best source of food that these babies have. And there is, of course, in many cases, there is environmental contamination all around them. So by stopping breastfeeding, we cannot guarantee that what they have instead is not also contaminated. However, breast milk has been a very good indicator of environmental contamination of populations. So I wanted to highlight again, in WHO, we don't promote child labor, and we don't think children should be working in hazardous conditions. But unfortunately, we have to deal with this subject because it is a reality in many countries, in many areas, and especially as we have seen that this happens mostly in the informal sector. So this is a very old picture, actually, but it's still quite relevant today. And I wanted to show you how an organism goes through different stages of development. And so we start during our whole fetal life and in utero life, and then even postnatal life. So you can see in red, you can see the times during our development when our different systems are extremely susceptible to environmental risk factors. So as you can see, for example, the brain, the first few weeks are crucial for proper brain development. And so when you have contaminant from e-waste, it could be, for example, a lead or mercury that acts during the specific time of the childhood exposure, the impact will be much more important than if it happens later on in life or during adult life. The same thing happens, for example, if another part of the body is developing. And for example, we know that many of these contaminants we will see, they have effects on almost every organ in the body. So it is very important that we don't allow children, and we don't allow children before they are born to be exposed to these contaminants. And brain development continues actually until about 20 years of life. So a lot of these exposures have meaningful effects even after in utero. So just to finalize on this short introduction, as we were saying, children have a longer life expectancy, so they could be exposed to something today that will not yield a health effect until 20 years, something that is cancerogenic, that could be present in e-waste. It could only have an effect later on. And then, of course, we have another challenge, which is the mixtures. And in electronic waste, we have mixtures of many contaminants. And that is only added to all the other exposure that a child goes through. For example, in many places in Africa, they still cook with biomass fuel. They use unclean fuels for cooking and for heating the houses, because that's the only ones that they have available, and babies often there with the mother breathing these fumes, which are in a large part responsible for childhood pneumonia deaths. So you add all these different exposures during a child's lifetime, and the impact could be really meaningful. So finally, of course, children do not vote, and we create the world in their place. So in the different webinars, we have seen that e-waste is a lot about environmental pollution, and this is what we see. We often see it associated with waste sites, with toxic waste sites, not specifically sometimes only waste sites, through open burning, through acid bleaching. We are extending this contamination into the whole environment through these primitive ways of recycling. And in many times, these contaminants also end up in landfilling. So there's houses that are later built on top of all these contaminated sites. So as we were saying, that it's not only the electronic waste where it is being burned, but at the same time, it is going into the dust, into the soil, into the drinking water, into the food. We see many times that people they grow their own vegetables in the same areas, and so this food and the same with the animals, are extremely contaminated with the e-waste components. Of course, the inhalation of the fumes, and we are, and this, as we were talking about climate change earlier on, this is in the end, it's all contributing to this global change impacts. So these are some pictures from a country in South America, but they are very similar scenarios occur in Asia and in Africa. And so many times the recovering and the recycling is done inside the house or sometimes in the backyard. There's acid baths, there's open cable burning, there's cooking of circuit boards, many times even in ovens that are used for cooking. So people get exposed to all these materials. Many times, so as we said, the workshops are home-based. They are done within the community. The child is there. The child often helps because the child has tiny hands, and so is very good at extracting the valuable materials. So this provides injuries, but it also provides very high levels of exposure to certain contaminants. So we recently, between different UN organizations, and the Basel Convention too, we published. It's an interagency report on the electronic waste situation in the Americas. We have a specific chapter on child health and e-waste in Latin America, And what we could see there was a very different scenario from what we can see in what we call the e-waste recycling towns. And so e-waste is collected as part of other kinds of waste. It's collected door to door for recycling. People come and ask for old electronic material that is not used anymore. And then it's torn apart in communities of scavengers, and this is the basis of their income. We had a case study in Uruguay where we saw, well, that these are family workshops, that even if parents, and this is something I didn't mention before, but even if the child is not working directly with e-waste, often the parents don't wash their hands or don't change their clothes or don't take the necessary precautions when they get home not to contaminate their children with all these materials that they bring in their shoes, in the clothes, because they don't know that they have to do it. There's also, as I said, schools, there's homes that are near waste sites. These informal recycling waste sites often move from one place to the other. As we said, we have the breastfeeding and the transplacental exposures. And I wanted to highlight this transplacental exposures because there are certain contaminants in e-waste, like lead, for example, that get accumulated in a woman's body. So, for example, the lead gets associated with the calcium and it remains in your bones. So once you're pregnant, this calcium gets, again, it goes into the blood and the calcium gets rearranged, and along with it, it gets recirculated along with the lead. So calcium and lead go together and they can reach the unborn child. So even if you're no longer exposed to electronic waste during your pregnancy, the accumulated exposures of certain of these heavy metals that you have throughout life will still have an impact on that child's brain. And so this is something that actually could have an impact across generations. As we said, we talked about contaminated water and foods. And I wanted to highlight this case study because Montevideo is a town that has had, unfortunately, a lot of traditional lead problems. There were whole housing areas built on top of old smelter sites, and there have been many populations with elevated blood lead levels. And this has been a challenge in public health for many years. However, the pediatric environmental health unit in Uruguay is, excuse me, this is my phone, is currently has currently done a study in which they found that 24% of the high blood lead levels that they have now are related to the burning of cables and of electronic waste all over the town instead of the old traditional hazards. So 25%, a quarter of the elevated blood lead levels in children are now connected to electronic waste. And this happens with electronic waste in general, but it's also, they are very keen right now. Apparently the market is very keen on the copper that you find inside the cables. So not only electronic waste is being burned, but in some cases there's even working material that is being stolen to retrieve the copper, and it's being burned by the hundreds together in big fires, and you can see the black stains all over town in different neighborhoods, in different areas that are left by the lead inside these cables. So as we said, and I think we have talked about this in these webinars before, and we are all aware that in several places all over the world, and I'm bringing up Guiyu in China, but the same is true for Abogloshe in Ghana, there are whole areas, whole towns that are dedicated to the informal recycling of e-waste. And we have found, studies there have found very elevated metals in the children, and of course specific suffering like breathing ailments, skin infections, stomach diseases that are typical of the children being there. And there's numerous numbers of people working here, and we also understand that from a social point of view, these people often don't have another choice but to work here. And not only that, but also in a way, being a waste scavenger is something that may not be very glamorous, but when you're a reverse engineer or someone who works with e-waste, it kind of even brings a social status with itself. So So as we said, e-waste is not only ugly pictures and environmental contaminations, but it has an impact on health. And we led a systematic review with our collaborating center in Australia about 3 years ago, and we looked at all the studies that were studying e-waste exposures, whether direct or indirect exposures in the environment. And these are a few of the effects that we found. Increases in spontaneous abortions, stillbirths, premature births, reduced birth weights, birth length, and also there were other issues like, for example, disruption of the immune system that can lead to a whole different array of health effects later on in life. So this is just, and I borrowed this from Dr. Chen at NIHS, but it shows that this is just a very small list of some of the contaminants in electronic waste. And through many different toxicological mechanisms, they have a very strong impact on the development of our brains. And so in addition to these populations working on e-waste recycling being many times already being away from education and being in very socially challenging environment and being poor, they are exposed to these neurotoxicants that may also affect the way in which they can learn. So even if they went to proper school, even if we provided them with a fantastic education, their brains have been compromised from the beginning. So this is just to, and we have a training module where we have all the different components in electronic waste, and what we found, like with mercury and with chromium and with all the other ones. But just because e-waste is a mixture, this is some of the toxic effects, of the summary of the toxic effects that we have found on health and on children as well. So one of course, it's very difficult. Again, we try to come up with a burden of disease estimate of electronic waste, but you have so many different components, you have so many different chemicals, and so many different ways in which a population is exposed that it's very difficult to come up with a single scenario, a single number, a single solution. And of course, the effects on child health and on human health that are related to electronic waste depend a lot on the type of waste, on how long they have been recycling, how much, what kind of waste, how far is the child from the area of exposure, if the parents are actually recycling themselves or the child is recycling. And then, as we were saying, I mean, some of these recycling areas have been, in some places, of this informal recycling has been happening for a very long time, and in different parts of sometimes the same city or the same place. And pregnant women may have grown up with exposure since childhood, whereas others may only have been recently exposed. And we know, and I put it here, we also know it has effects on not only on women and on children, but on men as well, and it even affects spermatogenesis and reproductive health. So to get away a little bit from these health effects, and I wanted to bring this to a higher consideration. And so when we talk about electronic waste, we have so many different challenges ongoing today in environmental health, and we think this is an area where there is action that could be done now. This is an emerging area. This is at least for health, and it's one area where there are many solutions that have been identified, and I think it's one of the best examples of how intersectoral work can do a difference. And so it's particularly relevant now that we have stopped and have unfortunately failed on some of the Millennium Development Goals. Sustainable Development Goal number 12, to ensure the sustainable consumption and production patterns, but also the health goal number 3, to ensure healthy lives and promote well-being for all at all ages. We will fail again unless we provide proper solutions to the electronic waste challenge. So again, our estimates in WHO, we provided estimates 2 months ago, and these are not specific to electronic waste, they are on environmental risk factors. But we know that at least, and this is probably only the tip of the iceberg, that at least 12.6 million people died in 2012 because of working or living in an unhealthy environment. And we know that the most affected are the children and, of course, the older adults. In the next World Health Assembly at the end of this month, countries will discuss a resolution and hopefully will adopt it on the role of the health sector in the sound management of chemicals, and this includes toxic waste and therefore electronic waste. So there is the opportunity right now to take action and also to raise awareness about this. I have the feeling that still a lot of health ministries are not aware that the electronic waste and all these donations that they have that are amazing to improve things like education, for example, 1 laptop per child, then have to be followed up by future measures, so that all this IT and all these different equipment don't turn into waste later on. And so yes, and there are many other initiatives in WHO. We are promoting urban health. We are promoting greener economies. We have at the national level, environmental and health action plans. So there are many from the global to the local and to the national arena. We have a lot of opportunities for action. So as I said at the beginning, we started in 2012, 2013 working on this on WHO. And first, with our systematic reviews and initial publications, we better defined the exposures. And we realized that there are so many exposures that e-waste is basically pick your poison. And so we know that there's quite a few materials in there, including the heavy metals, that we have enough information on to start acting. And so we wanted to identify which were the best measures to help the health of the children, and we got together with experts and a few of our collaborating centers that specialize on child health and toxicology, and we started looking at how to put together the necessary information from health to highlight once again the impacts, but at the same time to start looking at what can be done from a country level, from a health point of view, to actually solve this problem together. So these were the main gaps that we identified through our expert meetings, and we brought in people who were working on in Gloche, who were working in China, who were working in these different sites, and we really wanted to hear their input. And we work with other UN agencies, because I think one of the beauties of this event being organized today is that we all have a role to play and we should coordinate it. So again, we needed to better identify the needs at the local level, learn how to better communicate to health actors, develop capacity building for the health professionals, continue with the research around e-waste, even though we know we have enough to act now, and to get the right partners on the table to help these communities, to support these communities in finding their own solutions. So when we think that the doctor, the nurse, the primary healthcare worker, the health agent, often on site and on these communities, has a key role to play. There's many different aspects. Not everyone can do the same, but they have a key role in identifying the problem, in diagnosing this kind of exposures, in asking the key questions that will allow them to identify patients and communities that are exposed to this or that are working on this, treating the health effects, educating others, educating their peers, getting the word known, working with the community and the children. Of course, no intervention will ever have any impact unless you bring in the community leaders and ultimately teach the children themselves. We also understand that sometimes for health professionals, it's not so easy to engage with policymakers and to influence policies. So this is some of the things that we think are really key as part of this intersectorial work. And then, of course, they can implement the appropriate measures, which have, of course, to be tailored locally. And then they have to evaluate the measures that have been taken, and for that, monitoring has a strong role. And then, of course, continue developing their surveillance. We also think that interventions related to electronic waste, of especially community interventions, and if we build the capacity of small teams at country level, that will not only help us address the electronic waste problem, which is major, but also other problems related to toxic waste, to toxic chemicals. So there is an opportunity here to have a bigger impact than just with electronic waste. So a few of the slides that I'm using today are part of train-the-trainer modules, which are PowerPoint presentations with full notes and references that we have developed throughout the years with pediatricians and toxicologists. And so we have a whole package of modules that are ready for anyone who wants them to use. And one of them is on electronic waste. So everything that a healthcare provider needs to know about electronic waste and didn't dare to ask. And at the same time, we have other modules that look at things like how to best diagnose and treat lead exposures, and the same with mercury, and the same if you see neurodevelopmental effects on a child, or respiratory effects on a child, or immune system effects on a child. What should you be thinking about? Should you be thinking about lead? Should you be thinking? And that eventually will lead you to the root of the problem, to do better prevention, and the root of the problem in many cases, in some cases, could be electronic waste. And we also have a lot of publications and technical information on the health impacts. And then we have newsletters, and we have our websites, and we have tools for information dissemination. Sorry, and I won't go through them all now, but I put at the end a resources list so you can have access to a lot of this. So we think again. I remember many years ago when I started working in WHO, I worked with a toxicology who worked on child health, and one of the areas she specialized in was lead exposure, and she said that in many cases that there were too many scenarios with lead. In many cases, countries didn't know they had a lead problem. And in other cases, they knew they had a lead problem and sometimes decided not to be aware of it. And throughout the years, we have advanced our lead interventions. Lead has almost been completely removed from the gasoline. It is our fight in WHO and UNEP and other agencies to get it out of paint. But there's still many other uses that could be where it could be removed from. And I think for electronic waste, we have a similar scenario. In many cases, there is not an awareness that this electronic waste is having a health impact on people. So we still have a very important role to play in our communication and awareness raising. And of course, it's very important that we work together. I think everyone has a different piece of the possible solutions to bring in, and of course there is no global solutions, there's only local and culturally appropriate solutions, so these then need to be tailored. So that brings me to, again, I think we have an important role to play in interventions by, again, strengthening the monitoring of electronic waste, seeing the impact of interventions, by providing information to the health workers and then to the vulnerable populations, see how to communicate this issue to the communities, and also at the same time how to provide solutions. We understand there are many challenges. For example, protective equipment is often not used because it slows people down. There's other interventions that are looking at how is it possible to actually separate different parts of which parts can be separated by the informal sector from e-waste and which not. And so some of the solutions are not completely clear, but I think when you talk to a community and you let them know of the impact on the health of the children, and then there's also some kind of intuitive measures like don't bring your e-waste home, don't expose your child to that, just wash your hands. And there's already a lot of measures that could be communicated from the health sector as we wait for the final solution, which is actually prevention of exposure, which is actually removing the exposure and is actually taking these children and these communities, not allowing them to contaminate the places where they live and they study and they dwell. And so finally, again, we think the health sector has a very important role to play and is often close to the families, and they listen to the primary healthcare worker, to the community worker, to the doctor. And so the capacity needs to be built at public health as well. Again, there's a very important role to play from the other sectors on the policies, on the recycling sites, on the on the finding other job opportunities for this informal sector, or actually formalizing this activity. So anyway, so the bottom line of all of this is that we all need to work together to protect the health of our children. Thank you very much.